Now starting. All attendees are in listen-only mode.
Okay, let me just pull up my screen sharing now.
Yep, I can see it.
All right, you see PowerPoint? Okay. So let me go here.
Okay.
All
Good
right.
afternoon. Welcome to the webinar. And I'll leave you with Lillie and Jonathan Holland right now.
Sorry, just navigating.
If you go to the lower left corner, bottom left corner, hover on and the little menu should appear. Representation.
Can you see the PowerPoint?
Yes.
Okay.
You're ready to start.
Can you still see me? Okay, perfect. Okay, so hi everyone. I'm Lillie. I have Jonathan with me. We're going to be giving you a presentation today on motivational interviewing for HPV vaccinations. Hopefully to give you some tools that you can use when you're meeting with patients who are hesitant or not comfortable with the HPV vaccination. Okay, let's see. There we go. Okay, so today we're hoping to understand the basics of motivational interviewing and practice these principles. We're hoping to strengthen your ability to elicit change and talk and commitment language. Basically, we'll go through these steps later on how to start this conversation in a motivational interviewing style. And then learn communication techniques that encourage HPV vaccine acceptance. So some reasons for children not getting the HPV vaccine are concerns over safety, pain, which kind of seems silly, but having a child myself, like I can totally understand why parents would not want to see their child go through any pain. Parents concerned about fostering sexual promiscuity and belief that child won't have sex. This one's pretty common as the age is around 11 when you're getting starting to recommend the HPV vaccine, and that can seem really young to be administering a vaccine that prevents a sexually transmitted disease. Gender, boys versus girls, not thinking that boys may not need to get the vaccine. Again, age too young, just based on other fears about vaccines as well as the sexual promiscuity. Vaccine being too much for their immune system when given with other recommended vaccines. So a lot of times this vaccine is recommended when they're getting other vaccines at the same time. So parents might think that, oh, I just want to get the ones that are required for their school, and I don't want to have to worry about putting too much stress on their immune system all at once if this one is only just recommended. And then parents saying that the physician did not recommend the vaccine. If anyone else has heard any other concerns and wants to put them into the chat. Okay, and we'll move on to. So a study in 2014 showed that providers were actually underestimating the value that parents were putting on the HPV vaccine. So the bar right here in the HPV column on the left shows that parents are putting value on the HPV vaccine, just providers are thinking that they're not, and so that may be causing some gap in their recommendations. So some strong provider recommendations is you want to make a personal, strong provider recommendation. So when you're talking about the HPV vaccine, you want to make sure that you're coming at it with confidence and that you are really supporting the vaccine. So an example, now that Sophia is 11, she is due for 3 vaccines. These will help protect her from infections that can cause meningitis, HPV cancers, and pertussis. We will give those shots today. Another concept to talk about is the same day, same way. So basically, this is the idea of when your patients are coming in to get their required vaccinations for school, trying to get them to take the recommended vaccinations at the same time. And so you can do this by making sure all the clinical staff has the same information from your MA to your nurses, making sure you're all on the same page. Avoid assuming the parent will decline vaccines. This is just getting rid of our bad implicit biases. We should be treating every patient like the same and recommending vaccines to every patient despite their backgrounds. Place equal importance on recommended and required vaccines, like I said, and then you can have these types of conversations with friends and family as well. One common conversation that comes to mind that I actually have with my family is talking about the flu vaccine. So a lot of times my family doesn't always want to get their flu vaccine because you have to get it every year. So it's kind of a similar conversation that we have to have. So traditional non-motivational interview style of conversation might flow a little bit more like this. So if you came in and you were recommended the HPV vaccine, your patient might respond in one of 3 ways. They might accept the vaccine and have it given that same day. They might say no with resistance or not sure about it. And in a traditional non-motivational interview style, the provider might ask why the vaccine is not wanted, what the parent's thought process is on that, and the parent will likely state, why they have these beliefs, what are their reasonings for not wanting to get their child vaccinated. And this prevents the parent from being more open to the possibility of the vaccination and can strengthen their own argument against it. They can kind of like talk themselves into not wanting to have it by going about it this way. And then there's also some possible communication traps. So there's the persuasion trap, which is being a champion for the vaccine and trying to convince the hesitant, resistant parent of the benefits. This can end up in an argument, and the parent can just keep cycling back about all their concerns, and can kind of get exhausting and turn patients away. There's the lecture or the data dump trap. And this is providing the full story of some aspects of the vaccine. So it usually ends up putting people off because it implies they don't understand the vaccine's history and can be counterproductive if you end up raising concerns that parents had not previously considered. So yeah, it's kind of maybe giving more information than is actually necessary at the time. We want to keep our patients informed, but not scare them away at the same time. And then the yes/no question and answer trap is using a series of closed questions that require yes or no answers and does not encourage dialogue. So we've learned a lot about asking open-ended questions in CMR and doing our patient encounters, and it still applies here. It's really good to just avoid these yes or no questions. They just don't give an environment for good dialogue between the patient and the provider. So in summary, a strong recommendation works for the parent who is ready to have his or her child vaccinated or who expects the doctor to tell him or her what to do. we recommend you begin with strong provider recommendations for every family. For parents who are unsure or resistant, a closed question following a recommendation can lead to less productive conversations. So really avoiding that lecture style, avoiding the yes and no questions, and avoiding getting into those yes but cycles is the key here. And then I'll pass it over to Jonathan.
Thank you, Lily. So like Lily was saying, that if you use more of a traditional approach, you can meet a lot of resistance. And that's where motivational interviewing comes in and is really great at helping to open those doors and really encourage that dialogue and the communication between the provider and parents, as well as involving the patient or the child. Next slide, please. So how motivational interviewing fits in, obviously we want to start off with making that strong provider recommendation and then gauging what the parent wants to do from there. If they're interested and they say yes, we can vaccinate. If they say no, that's when we need to implement our motivational interviewing skills. We're going to talk a little bit about some approaches, some techniques, and really the framework behind how to engage a parent or a patient using motivational interviewing. Right? So in a nutshell, motivational interviewing is client-centered. It's a communication style that's used to guide a person's own motivation towards change or behavioral activation. A lot of times motivational interviewing is used for smoking cessation, but today we're going to talk about vaccination. Next. All right, so motivational interviewing. Let's start a little bit with the spirit behind motivational interviewing. Evocation is a rather fancy word for saying drawing out or identifying what the patient's concerns, beliefs, values, and feelings are. And then we're going to want to engage them with collaboration. We don't want to belittle, we don't want to take a hard approach or a lecture. We want to ensure that a dialogue is continued and that both the patient and the provider or the parent feel that they are being heard. Again, always we want to respect the patient's autonomy and do everything we can to emphasize their autonomy and their choice to self-directed healthcare. Now on the right, the motivational interview principles, again, express empathy, develop and identify the discrepancies. This is primarily in regards to the patient. You're going to want, or the parent, you're going to want to identify what those discrepancies are alongside the patient or parent and help them work through challenging and correcting those discrepancies. And as a provider, we can do that by supporting their self-efficacy and rolling with the resistance that a parent or patient might have. If a parent says, no, I don't want to do it, then we need to come at it from a different angle, a different approach, rather than approaching head on. Think of it as dancing compared to wrestling. Next, please. Okay, so again, motivational interviewing, we want to arrange the conversation so that the client talks themselves into change. It's all about putting the idea into their head and helping them work through their discrepancies and moving forward with vaccination. And it requires us to listen. Listening is very important for motivational interviewing, and we'll talk more about other techniques, but always remember listening is going to be your #1 goal. Next. All right, so how do we approach motivational interviewing as a provider? Open-ended questions, like Lily said, closed-ended questions can be a barrier to communication and can cause parents or patients to become defensive. So we want to use those open-ended questions like we learned in CM&R to ascertain what the patient or parent is thinking or feeling. Affirmation is very important as well. We want to use that alongside reflection, which means in a very simple way that we want to paraphrase and repeat back to the patient or parent what we're hearing. And that also involves summarizing what the parent or patient has said. That way that the parent or patient knows that we are listening and we're engaged in a conversation with them. Next. All right, so leading up all to reflective listening, we want to make sure that the parent is ready. We never want to force a parent or a patient to do something that they're not ready to do. We don't want to deny their informed consent or their autonomy. And in order to be ready, we need to reflect back all the reasons that the parent has stated for getting the vaccine. Now, if a parent or patient is unsure, we need to identify and reflect those cons or those concerns back at the patient as part of the motivational interview in order to help identify what their reasoning is for being unsure. Never take either side of the argument. You want to try and remain as neutral as you can, primarily if you're dealing with more than one parent. Sometimes one parent can be for the vaccine, another can be against the vaccine, and you need to kind of take the middle ground to help both sides come to an agreement. Again, if the parent sees ambivalent and is pressured to defend his or her stance, they will do so, and that's a non-motivational interviewing style. And again, sometimes a parent or a patient isn't ready, and the best we can do is reflect their concerns, affirm that their concerns make sense to them in the context of how they're thinking, and agree to come back to this conversation or discussion at a future time. Next. All right. So there's multiple ways to do it with reflective listening. Simple reflection, short statements, straight to the point, paraphrasing with some of the parent's own key words. I believe we have an example here about if a patient had said, I know you keep saying my daughter needs the vaccines, but I'm not sure it's necessary. A good reflection could be, even though I'm encouraging you to get these vaccines, you're still unsure if it's needed. Just again, rephrasing, paraphrasing what the parent has said. But also we can consider complex reflections. Next slide. And these are pretty similar. Complex reflections, however, go beyond what was said and offers a new perspective. So think of it as adding additional layers to the response. You want sometimes amplifying a statement, such as taking it to an extreme, can be a double-edged sword. Taking a double-sided approach, reflecting on the pros and cons, is generally more acceptable. Guessing the unexpected, bit of a double-edged sword sometimes as well, especially if you're not quite sure what the underlying statement is. If you get it wrong, sometimes patients and parents can become defensive. As of course, you always want to consider affective feelings, reflect back on those feelings or expressions that the patient or parent is expressing. Continue the paragraph, let the listener finish their statements, never interrupt. And sometimes, if you can, use a metaphor, such as grass is greener on the other side, can really help put things in perspective for the parent or the patient. Next slide. All right, so resistance. Psychological reactance or resistance is a motivational reaction that occurs when a person feels that their sense of freedom or personal choice is being threatened or the range of alternatives is being limited. Of course, we always provide informed consent. We talked about the PARQ, which is the procedure, the assessment, the risks, other possibilities. That's something we need to ensure that our patient is aware of as part of the informed consent process, because if they feel that they are being bullied into a position, that's when you'll encounter a lot of resistance. Okay, so when a patient becomes resistant, sometimes you just need to roll with it. Common cues that a patient or a parent is being resistant is they're arguing, they're interrupting, they're ignoring, crossing their arms, being dismissive. So really pick up on those verbal and nonverbal cues. And it's not just the parent or the patient as well. This also applies to us as providers or the motivational interviewer. We don't want to come across as resistant to what the patient or parent is saying. So as part of motivational interviewing, we should consider slowing down. Come alongside and try to understand. Reflect on what you're hearing before you respond. take a few seconds after the patient or parent has finished talking and then reflect back. It shows that you're listening. And as always, support the autonomy of the patient as well as the parents. Next slide. So here's a great example. I just want to draw your attention to the last paragraph where the provider is talking about stating they certainly understand why you would feel that way. Great affirmation statement. Really helps the parent or the patient know that you're listening and you're helping to support them. May I share the reasoning behind vaccinating early? This again supports their autonomy, and it's collaborative and supportive education. And then ending with, then you can tell me what you think. A great open-ended question really helps to increase collaboration between provider, parent, and patient. Okay. And the elicit, provide, elicit. Now this is going to be the framework that you're going to want to use when you're engaged in motivational interviewing. You want to elicit information from your parent or your patient, and then you want to return or provide information and feedback back to the patient or parent. Again, you can see in bold, avoid I and you statements. You want to keep your discussion neutral, and we'll show you some examples here on the next slide. And then after you provide the information, elicit more information. Keep that dialogue and that circle moving. Next slide, please. All right, so here's a great example, great little chart for you guys to take a picture of and use in the future. As you can see, we elicit information, and then we provide information, again, avoiding those I and you statements, such as research suggests, studies have shown, others have benefited from, and then once we provided our information, go back to eliciting more information and repeating this cycle as needed during the motivational interview.
Okay, so now we're going to talk about how to incorporate using motivational interviewing into talking about the HPV vaccine with your parents and children. There we go. Okay, so you want to make a personal, strong provider recommendation, what we had talked about before. An example is, so I see that Mary has just turned 12. Since you're here, this would be a great time for her to get those vaccines, which are recommended at that age. These are Tdap, HPV, and meningococcal. What questions do you have? And you can add about our plan. So this is making a strong recommendation, but you're also at the end tying in that collaboration and leaving it open for the patient to answer. So then continuing on, your parent is going to respond in one of three ways. They're going to say yes, and then you can give the vaccine. They're going to say no, and you'll see the resistance to the recommendation, or not sure. And that's where the hesitancy and the ambivalence about the recommendation comes in. So again, you're going to explore the parents' thoughts about the vaccine, and you're going to reflect back on pros and cons of what is stated. This is where you're going to do that reflective listening. You're going to roll with the resistance, and you're going to affirm what their concerns are. You want to engage in two-way conversation. So again, adding that collaboration. How does this plan sound to you? And then provide an equal and common ground for beginning the discussion. So taking away those I statements, putting in, this is what we know, all of those statements that we talked about earlier in motivational interviewing. And then again, just throwing in those affirmations of why the parents are concerned and using your knowledge and research to kind of give them some confirmation. And then you want to support autonomy in the parent's decision. So again, just reaffirming that this is their child and they totally are the decision maker. It's up to them if they want to get the vaccine today. So continuing the conversation, you want to use that exploration of the parent's thoughts about the vaccine. So it seems like you may have some questions or concerns about the vaccine Mary is due for today. I'd love to hear what you are thinking. Would it be okay if we discuss those? So again, we're adding that collaboration with the parent, and we're making sure that they're feeling comfortable and safe. The provider reflects back what the parent is saying to convey understanding and summarizes what has been heard before offering, with permission, additional information. The provider also supports autonomy. So using our reflective listening, we can say, you are concerned about the side effects of the HPV vaccine given that Lisa has had reactions to other shots. That's perfectly understandable. May I share some information that might ease some of your concerns? Ultimately, however, the final decision is yours. Again, just giving that reaffirming statements to the parent and showing them that they are the ones who will ultimately get to make the decision. So when you're closing the conversation using motivational interviewing, you want to use planning. So summarize all of what you have heard the patient say and then ask the key open-ended questions. So where are you now? Your patient and parent may respond with they're ready now. You might have swayed them with your motivational interviewing skills and you can vaccinate today. They might be ready, but today is just not a good day. They weren't planning on getting the vaccine. They haven't prepared for it. So then you'll want to pick a date and schedule that first appointment for the HPV vaccine. The parent might still be unsure. They might need more time to think things over. This could happen, if it's just one of the parents coming to the appointment, they might want to discuss with the other parent before they make this decision, and that's totally okay. And then the parent does not want the vaccine. And that's where we just want to reinforce that it's okay. It's their decision. They are the ones that are in control of what happens, and encourage them to reconsider in a year or two, since the vaccine can be given up to age 26. And I think that's important to add in that there is kind of a cutoff age. And so it is, important for us to try to get them to take the vaccine by a certain point. So in summary, this style allows parents and patients to feel heard and respected. Again, we're using that reflective listening, and we're kind of affirming their statements. When parents don't feel pressured, they are more likely to explore openly and honestly their thoughts about the vaccine. So that's making sure we're not using a bunch of I statements, we're not giving them the lecture talk about a vaccine, and they'll be more open to have a conversation about it. And then hopefully it'll lead parents to see the situation in a new way to form different conclusions. And this whole process can be really quick. It can only take about 3 to 5 minutes. Okay. So we can do some practicing if anyone wants. I don't know if do participants have the ability to use audio? To use their microphones?
Yes, they do.
Okay. Does anyone want to practice being a provider in a situation like this? I know we don't have a ton of people joining us, but
I can you hear me?
yeah. Hi, Sarah.
Hi, I can practice being a provider.
Awesome.
I don't know how to turn my camera on. Can you see me?
I can't see you. I don't know if participants can turn cameras on.
Okay. You have my voice.
Yes. Jonathan, do you want me to be the parent, or do you want to be the parent?
I can pretend to be the parent.
All right. And then I can go ahead and give you some feedback, Sarah, if that is okay. So Sarah, you're going to be the provider and advising this resistant parent on getting the HPV vaccine for their child.
Okay, is there any other prompt, or I'll just go?
No other prompt. Let's say
Okay.
Jonathan has an 11-year-old daughter and she is due for her HPV vaccine.
Okay. Hi, Mr. Jonathan. It's nice to see you today. And I actually, I think I would probably talk to the 11-year-old, considering that's a good age to start talking to a young one about autonomy. So you're here today to get your checkup and talk about vaccines and schedules. Is there anything concerning that you'd like to bring up today, or just want to talk about, have information about?
I don't want to get the vaccine because we're getting a whole bunch of other vaccines today for school, and I don't want her to go through more shots today than what's necessary.
Okay, that's reasonable. I know that some people have a little more sensitivity to just the, too many pokes for vaccines, or sometimes you feel a little like off afterwards, and those are things we can definitely talk about. Has she had, or have you had, I'm talking to the 11-year-old, side effects or muscle pains or anything after vaccines in the past?
Yeah, she gets a lot of muscle pains, and then she's pretty tired for a couple days
Okay.
after she gets vaccinated.
Okay, well, how does this sound? How we do the vaccines for school today, and then we can schedule an appointment at another time and see how these vaccines go, and we can always, pre-medicated and that sort of thing with like a ibuprofen or something like that if it's a little uncomfortable. It usually only lasts for a day, but we can see how these go, and then you can come back at another time and we can talk about any other things you'd like to talk about, and get those vaccines started at your next appointment.
That sounds reasonable.
Okay, all right, that sounds great. And I'll get you some more information about the vaccine too, and just the schedule. And so if you have any more questions, you can, bring them next time and we can talk about them. And Dean.
That was great, Sarah. I like how you reflected on what he was saying and his reasoning, and I like that you came to a different solution rather than trying to push him. He had good reasoning for not wanting to get all the vaccines today. So then rescheduling out, I think you did a really great job on reaffirming what he was saying.
Well done.
Thank you.
Okay. Oops. Does anyone have any questions, or does anyone else want to practice?
So I
There's
don't
also-
see any questions, right? I don't see any questions. So you may just wrap it up unless you guys want to add anything. And just a reminding about the survey.
Oh yeah. So for those of you that made it today, there's going to be a survey sent out. And then if you guys can just fill that out really quick, it shouldn't take too long, just to try to help this learning platform improve.
We greatly appreciate it.
Yeah, thank you guys for bringing your peers, and thanks everybody for being here. Again, this project is something driven by the American Cancer Society, the CDC, the National Area Health Education Centers, Samaritan Health Services, and Oregon Pacific AHEC. And let's see, I think there's a question there. Oh, we are having kudos. Good job, guys. And yeah, so to help the CDC and the National AHEC gather information about this HPV project, please fill out the survey. You will receive it within an hour after this webinar, and your answers will be very, very, very appreciated. And I think, I don't know if Petra would like to add anything. Other than that, we're done. Thanks, guys.
Yeah, I just want to say great job. Thank you guys so much for taking the time out of your day to present, and thank you to the attendees for taking your time to watch your peers. I hope this was a good opportunity for you guys to be presenters, and I hope the feedback will help you evolve into great providers, which I know you guys will be.
All right, then thank you all for being here today. Have a wonderful day and have a great Thanksgiving. Bye-bye.
Bye, guys.